I've gone to medicine because I've always been interested in medicine, because I had a very unwell mother who needed lots of care. She was on lots of medications when I was growing up.
Your mother was here in Malaysia?
Yes.
Yeah.
Yes. I grew up in Malaysia, and she required lots of medication. I often used to fetch her medication and followed her to the clinic, which is across the road. And in fact, that doctor was amazing. He was quite inspirational. And so he was just a GP across the road, but he was just a very gentle person. He was really caring. He knew everything about each patient, and everything about my whole family even. So that was quite an inspirational thing. So that's when I actually got interested in medicine. So once I got into medicine, I felt a lot of attachment for people who are most vulnerable. And children are most vulnerable, and hence, and also they were the group of patients who were easiest to connect with. I found, although most other doctors may not find the same, I found them most easy to connect with. And also, what I found with dealing with children is that they want to get better quickly. They're not interested in staying in hospital. They want to go out and play. So they are the easiest to treat. If you know they are unwell, you treat them, they are running out the door. So I found that quite interesting, and that is very rewarding. Whenever you deal with children, as soon as they are better, they're out. They're not interested in staying.
Right.
Sometimes adult patients, they need more care, they take a longer time to recover, and so on. So
and they stress and they worry.
Yes,
and
exactly. So as soon as the child is well, the parents are happy, they're out of the door. So that was instant gratification, what you do. And as I went through my medical training, and I went through, when I came out as a doctor, I got involved with more surgical conditions, and I found that I was more a surgeon as opposed to a pediatrician.
So can you elaborate about that? How does one know as a doctor that he's more of a surgeon rather than a pediatrician?
Yeah, so a pediatrician is somebody who deals with a child and also deals with lots of medications, treat them medically, give them medicine before they get better. A surgeon is somebody who's more skilled with their hands. So I'm a more hands-on person. I'm a physically, I like to deal with my hands, operations, and so on. So I only found that as I graduated after medical school.
Okay.
And in fact, I was working with a fantastic pediatric surgeon, and that again, another second inspiration in my life to the route that I've finally taken.
This was in London?
This was in UK? Wales, in UK.
In Wales?
In UK. Yeah. So then I decided to take the path of pediatric surgical training.
Right.
So to do that, you have to do the surgical training first, and then do a pediatric medical training, and then finally go to pediatric surgery. So it's a long route. So it took me more than 12 years to get to that, my final destination.
Right.
So all my training took place in London. So my pediatric surgical training. So I went through big centers throughout the various different London hospitals, and finally I graduated and ended up as a consultant in St George's Hospital in London.
Okay.
Then once I graduated, once I got to be a consultant pediatric surgeon, I realized there's more to what I want to do, and I was interested in training, and especially skill-based training in keyhole surgery, which was what I was doing mostly in London. So then I decided to come back to Malaysia to train in the University Hospital, University Malaya Hospital in Kuala Lumpur.
Okay.
So there I was an associate professor for a few years.
Yep.
Where I was doing most of the basic surgical training for the master's program in Malaysia. And finally, at some point I left Malaysia to Australia to set up a keyhole surgery center in Gold Coast, Australia. And because of family reason, I came back to Malaysia, and now I'm currently in a private hospital, but I do training in several different public hospitals in northern regions of Malaysia, including Alor, Penang, and so on. So currently I'm practicing pediatric surgery in Kuala Lumpur in several hospitals. and my specialty is in keyhole surgery for children.
Okay, thanks, Doc.